Well, doctors, insurance companies, and hospitals are all trying to figure out what the Affordable Care Act means to them. But tonight, we're looking at how this sweeping health care reform law will affect the millions of Americans who already have insurance through their jobs. The Affordable Care Act, upheld by the Supreme Court last week, will have the most dramatic impact on the poor, the unemployed, and the uninsured. But more than half of all Americans have insurance through their jobs and pay only a fraction of the total premium cost themselves. The president had a message for them.
If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance.
It may work out that way for most people, but a fact check by the Associated Press pointed out that employers will be able to drop coverage, as they have always been able to do. Companies with more than 50 employees would pay a penalty for not offering insurance, but they could opt out. GOP presidential candidate Mitt Romney made a completely different claim.
Obamacare also means that for up to 20 million Americans, they will lose the insurance they currently have, the insurance that they like and they want to keep.
Very few people believe that.
Health News Florida publisher Carol Gentry believes Romney assumed the worst-case scenario.
It all depends on how employers decide on whether it's better to cover their employees or pay a penalty. And I think most employers have a good heart and would rather cover their people.
The president also said this about the insurance most of us already have.
This law will only make it more secure and more affordable.
Employer-provided health care will likely be more secure under the ACA because of restrictions against dropping sick policyholders and the elimination of lifetime limits. But the affordable part is a stretch.
Think about your own insurance. Does it change every year? If you're covered by an employer, you bet it does. It usually gets more expensive on the premiums, the co-payments, all of that. And sometimes...
Well, another change you can expect, a tax that you'll have to pay on so-called Cadillac insurance plans provided by employers, but that tax doesn't go into effect until 2018.